Hello, hello. Welcome back. Welcome back to the podcast. So, hope you guys are having an awesome week. It is one of those times where it's getting closer and closer to Christmas. I can't believe Christmas is already here. This is just insane. That's all I can say. It is insane. And I just cannot wait to start diving into the good things that I have prepared myself for 2024. Now, anybody that knows me knows that I do not do the whole New Year's resolutions because I don't believe in that. I believe that I set goals that are progressive because sometimes things shift, things happen, and shit just happens and life happens during the year, right? So it's good to have those progressive goals so that you can continue to work on it and you can actually achieve and accomplish something. So that's how I do it. And I usually start working on my stuff for the next year, like 3 months ahead of time. So 90 days before the year is supposed to be up, that's when I start working on it. So I got some good stuff coming down the pipelines for this podcast and just for my coaching business and just life in general, right? So in this episode, which this episode is very near and dear to my heart, as maybe some of you know, but most of you may not know, I am a CAT scan technologist. I do work in a level 1 trauma center in the city of Chicago. So I am very well and diverse on diagnostic testing, radiology testing, and things like that when it comes to your special needs child and your child navigating a rare disease. Now, little disclaimer. This is not medical advice. This is purely for informational purposes only. I am a licensed radiologic technologist where I do have credentials when it comes to X-ray and CT scan. I am not a medical physician and cannot give you medical advice. So if you have medical questions, you need to ask your child's medical team or your physician that you see, as this is just informational purposes to just help guide you to make the right decisions for your child. Okay, just a little disclaimer there. So we are going to talk about radiology tests and your child with a rare disease. Now, in the current facility that I work at, we do have a children's hospital attached to it. And I can tell you that there is a large population of special needs kids that do come through this hospital. I can tell you both of my children do get services at this hospital as well, especially my 12-year-old daughter, who has a team of 10 specialists, and there will be 4 more specialists added to that. So I think it took a long time to devise and create this team of medical personnel because it was not easy. There was a lot of firing done and a lot of research and a lot of just everything, right? So the patients that I do encounter that do come with, autism, they come with rare diseases, they come with different special types of needs. It is sometimes very difficult for, as myself as a technologist, to navigate and make sure that the patient is comfortable and making sure that your child has the best experience. So as a mom myself who has been through this process and that I have navigated just different radiology tests, diagnostic tests, just things of that sort, I'm going to give you some tips. So if you ever have to have a exam, your child has to have an exam in the radiology suite, exactly what kind of questions that you can ask and, some of the things to look out for when it comes to just navigating the whole healthcare system. Now, depending on the types of, clinical things that are going on with your child, sometimes doctors will order an X-ray, they'll order a CT scan, they will order an MRI, they will order ultrasound. Those are just some tests that they might order. Now, let's say, for example, they're going to order a CT scan. You have to make sure that you're prepared on what type of CT scan it's going to be, what is required, if there's any type of injectable form of medications that we have to give the patient, your child, if they have to dress a certain way, if they have to stop eating, stop drinking, those are all relevant questions that you can ask when you schedule your appointment. Now, it's also very important to ask questions before the exam starts to the technologist. Ask them how long the test will take. A lot of times, especially with children who have rare diseases, need to be put under sedation where they're asleep, and that requires you to hold their feedings and hold water and different types of things so we can get an optimal exam on your child, right? So the questions that you can ask is how long the test will be, what is required for this test, what exactly are they looking for on this test? Because as a technologist, we have to review the charts and we have to review everything that your child is getting done. So those are some relevant questions that you can ask to make sure that your child has the best experience. Now, I know at most hospitals, when it comes to pediatrics, they do have a specialized nurse. It's called a child life support. So these are usually nurses that will come in and help make your child feel more comfortable, whether it's an iPad, whether it's a toy, whether it's a blanket or a stuffed animal. I have used them and they are wonderful because they really cure the anxiety that I have to put that comfort into my child so that my child is comfortable during whatever procedure, during whatever test, whatever it is that my child's doctor has scheduled for her to have. It really puts your mind at ease. And I encourage you to seek them out and to have them assist you when it comes to these type of exams. Now, when it comes to CAT scan, we do use immobilizers where we might put them in a baby holder if they're young, or we have table straps just to keep them safe on the table so they don't roll over. We do have devices where we can immobilize them just so that we get clear pictures, because the whole goal is that we do not want to repeat anything on your child. And because of radiation concerns, we don't want to repeat that either, because we want to get one test and be done. It is not recommended to repeat exams on young children or any type of young child, because the radiation concern can definitely elevate and it's never a good thing. Okay. The reason being is because radiation is more sensitive when you're young versus when you're an adult. And there can be certain consequences, especially if they continue to repeat exams on your child. Okay. So what I want you to take away is ask the questions. When it comes to contrast media, if there's something that you don't understand when they say that term, say, can you please explain that? So contrast media is a form of X-ray dye that goes through the vein. What it does is it helps the radiologist look at different types of conditions that your child may have. So it's a really good, useful tool because it'll show up on the CT scan and it'll highlight all the areas that need to be highlighted for the interest of what is going on with your child. So you can ask, what are the side effects? Is there anything that I need to do when we get home, as far as should they drink more water? Can they eat? What will they feel when this injection goes in if we're doing that? So commonly what I tell my moms or parents is that they will get warm. They might get a funny taste, or they might have a sensation like they have to pee, because those are all the side effects of when we inject this X-ray dye. Now, usually what I tell my parents is that once we're done with any type of CT scan, to make sure that they drink water, if they want to drink juice, whatever it is that they like to drink, just to kind of flush that stuff out. Make sure they eat. If their child takes any medications, make sure they do that. So those are all relevant questions to ask. Now, when it comes to follow up with reports, those we will recommend that you follow up with your child's doctor. And usually it'll take a few days for them to read the CAT scan results. Usually that's what it is. I know there are some places that may take a week, but it all depends on that hospital's policy. Okay. So those are relevant questions to ask. And what I encourage you as parents is don't be afraid to ask. The technologist should be knowledgeable in answering all your questions. Because sometimes when it comes to those tests, not all the doctors know exactly how to answer them. So, what I would recommend is speak to the technologist. Ask them the questions because they will know exactly how to answer all your questions. If there's something they don't know, they will involve somebody else to answer your question. Okay. Don't be afraid to to ask questions. I want you to feel empowered to ask questions because you are your child's best advocate and you know what is best for them and you know what your best judgment is. So don't be afraid because I get asked a lot of questions by moms and dads all the time. And I do my due diligence and my best to answer all their questions. And if I cannot answer their question, guess what? I seek somebody out to answer their question and to make sure that they have the answers that they need. Okay. So those are some tips from a CAT scan technologist like myself that I can provide for you. And if you have any questions, please don't hesitate to email me, send me a DM on Instagram. I am more than happy to chat with you and work through whatever questions you may have as far as this topic. Okay. I hope this episode was helpful. Please like, share, subscribe, get it out there so more moms and parents listen to this podcast because I think it would be a useful tool. And as always, if you're interested in diving deeper into helping you navigate not only challenges, but creating a thriving life and just creating this comfortable, peaceful, just environment for your child and to have some kind of mobility and to have stability and to find that just that wonderful space that you want to enjoy life with your child, check out the details of my coaching program. We start in January, and I just go into an awesome step-by-step framework where I give you the tools and resources, but I also give you that confidence and that knowledge that you can advocate and you can just make those decisions for your child. All the details will be on the show notes, so make sure you check those out. If you want to take your self-care and prioritize it 2.0 style, I have an awesome 3-part masterclass that you can go ahead and grab. So get in that masterclass. It'll be on the show notes. So make sure you do that and just check all those wonderful things out because there's some great stuff coming for 2024. So hope you guys have an amazing, amazing week and we will chat next week.